In this video, we're going to do a quick overview about IV solution. It's a lot to remember in nursing school when it comes to IV solutions, and it can get pretty tricky. So I'm going to help you break it down and understand them. Also, stick around until the end. I'll be including a bonus question to test your knowledge. So let's begin. Hi guys, it's Nurse Aleen from Go Nursing RN. As mentioned, today we're going to be discussing IV solutions. Intravenous fluid replacement that we will be discussing are called crystalloids. Those consist of isotonic, hypotonic, and hypertonic solutions. These solutions will flow easily from the bloodstream to the cells and the tissues. When we are thinking about fluid shifting within our cellular system, we have to understand something called osmosis. In our cells, we have an intracellular space and an extracellular space where we have fluids and electrolytes. Our bodies want to have everything within balance. We want to ensure everything from outside the cells and the inside of the cells are matching. Osmosis is what helps us reflect that movement within fluids from an area that's less concentrated to a more concentrated area. A good way to think about this is if something is more concentrated, possibly can mean that there is less water and more sodium. With osmosis, it's going to allow that fluid to shift to the area that has more sodium, more concentrated. That simply reflects the phrase, where sodium goes, water follows. Let's start with isotonic solution. Iso means same or equal, and tonic means a concentration. So that means that the cells have the same concentration on the inside and the outside, which is normal. This simply means that the osmotic pressure is the same, so with these fluids, the cells do not shrink or swell with any of the fluid movement. Isotonic fluids include 0.9% saline, or also known as normal saline, 5% dextrose, that is in water, D5W. This also can be used as a hypotonic solution after it is administered because the body will rapidly metabolize the dextrose and then we are just left with water. So it is going to be considered isotonic at first because of the dextrose. Also 5% dextrose and 0.225% saline and lactated ringers. Isotonic solutions are used to increase the extracellular fluid volume due to blood loss such as surgery, dehydration due to vomiting, diarrhea, burns, and sepsis. It will not cause the cells to shrink or swell. All we're doing is replacing that fluid volume. Of course, we want to watch out for our patients that possibly have CHF because we don't want them to go into fluid overload. A memory trick for you for this one is going to be isoperfect. This means that the balance in and outside of the cells is not shifting or going through any osmosis. It's perfect. Hypotonic is the next solution. Hypo means under or low, and tonic again means solution. The cell has a low amount of solute outside the cell, the extracellular space. So think of that area as diluted and wants to shift fluids now into the cell, the intracellular area. So it will go out of the vessel and into the cells. This will cause cell swelling, which can cause the cell to burst or lysis. This would be considered an adverse effect, and we do want to watch out for that. Some hypotonic solutions include 0.45% saline, which is also known as half an S, 0.225% saline, 1/4 an S, and 0.33% saline, 1/3 an S. Hypotonic solutions are used when the cells are dehydrated and we want to put fluids back into the intracellular space. This can happen to patients that are in diabetic ketoacidosis or HHS. Now, it's important to be cautious because we're pushing a lot of fluid away from the extracellular space into the intracellular space. We don't want to dehydrate the patient. We don't want to push fluids or move fluids in patients that possibly are already hypovolemic or are pretty much depleted from fluid volume. A memory trick for hypotonic is think about hypotonic fluids are hypotonic cells that all the fluid go into the cell causing them to swell. kind of like a hippo's mouth, right? A big O, right? Swelling of the cells. The third one is going to be hypertonic. Think about the hyper portion of this as excessive. The cell has an excessive amount of solutes extracellularly, and the osmosis is going to cause the water to rush out of the cell intracellularly to the extracellular area, which will cause the cell to shrink. Hypertonic solutions include 3% saline, 5% saline, 10% dextrose in water, 5% dextrose in normal saline, 5% dextrose in half normal saline, and 5% dextrose in lactated ringers. When using hypertonic solutions, we want to be very cautious when we're giving them and should be possibly monitored in the ICU because they can cause side effects of fluid overload and pulmonary edema. Also, hypertonic solutions should be given via central line because it can be a vesicant and cause risk for infiltration. A memory trick for hypertonic fluids is think the hypertonic fluids are for skinny cells because the fluid goes out of the cell, making it skinny. When people are hyper, they become skinny. It's time for the bonus question. What kind of IV solutions cause cell dehydration and help increase fluid in the extracellular space? A. Hypotonic, B. Hypertonic, C. Isotonic, or D. Lactated ringers? B is correct. Hypertonic are going to be solutions that will push water out of the cell into the extracellular area and can be used in patients, for example, that have hyponatremia or cerebral edema. If you found this video helpful, don't forget to like and subscribe here below. Also, question for you, what memory tricks do you use to remember these IV solutions? Share in the comment section here below. See y'all next time.